Hey, welcome to another episode of Clear Light Connections, where we talk to the people behind the businesses of Bay Area Houston, proudly sponsored by UTMB Health. Today's special guest is Misha Syed, and you are a doctor of ophthalmology at UTMB?
That's correct.
Tell the audience about ophthalmology. Most people go to an eye doctor. That's not the type of eye doctor that you typically, that an ophthalmologist is.
Correct. Yeah, there's a lot of confusion around the term eye doctor, and it is confusing, to be honest. So my training, ophthalmologists train in medical school to begin with. So we get our MD degree, we get training across all of medicine, and then we choose to specialize in the eyes. And so that branch within the field of medicine is called ophthalmology. So we're trained to take care of patients' eyes from a not only the eye itself, but from a systemic perspective. So we understand how the body works with the eyes and vice versa, and kind of how different diseases manifest themselves in the eye or elsewhere in the body. So it's kind of a more holistic and overall medical approach to the eyes, but that also includes a component of surgical training. So when you do an ophthalmology residency after medical school, you get trained not only in understanding the medicine of the eyes, how the eye works, but you're also understanding how to use surgical and medical treatment to help people's eyes and their vision. So that's long story short, I guess. But we also have valued colleagues in the field of optometry, which is what you're referring to. A lot of people call their eye doctor that they go to for yearly glasses or contacts checks, for example, who also do thorough eye exams. That's their eye doctor. That's an optometrist. So the field of optometry is closely related to ophthalmology, but their training is quite different. So they'll go to undergraduate college just like we do, but then they choose to specialize only in the eyes. So they'll go to an optometry school. Okay. And that is going to be, 4 years of training. And then typically, they'll go out and start being optometrists or eye doctors right after that. Some may do, a year or two of what they call kind of their residency, but it's not training across the board in all of medicine like we do. So it's a different way.
So what got you interested in ophthalmology? I mean, obviously you went to medical school, right, and you picked it as your specialty. What got you into that?
So I definitely did not pick medicine as a field to do because of the eyes. Actually, ophthalmology was not on my radar at all. As it is with most of us who go into ophthalmology, we don't often have an understanding of that being a specialty we can think about. When you think about medical school, you think about, your own experiences with your pediatrician, your internal medicine doctor, family medicine. Those are the big, what you picture when people think of being a doctor. And so a lot of students, myself included, go in thinking, I'm going to do one of those things. And I really thought I was going to do pediatrics, to be honest. And I had the happy accident of taking a rotation in ophthalmology in medical school. It's not offered as one of what we call our core experiences, because it's a specialized kind of surgical field, surgical specialty field. It's not built into this is what everyone does, which is internal medicine, surgery, pediatrics, et cetera. So I had time in my medical school curriculum to do an elective, and I thought I need to learn how to do a good eye exam. Because, if you remember, if you go to your doctors, they'll shine a light in your eyes, they'll do a kind of a basic eye exam. Mm-hmm. So I thought I need to get better at that. And here I am, 25 years later, and this is what I fell in love with when I got to do that rotation. So you never know.
So it's Health Vision Month. Mm-hmm. Let's talk about why keeping up the health of your eyes is so important.
Right. So like I was kind of mentioning earlier, the eyes are connected to the rest of the body, right? So there are all kinds of things that we as ophthalmologists can find in the eyes that can be connected to other processes happening in the body. We can see things like diabetes, high blood pressure, different diseases of the brain through an eye exam that we do. So I think people often will say, well, my vision is a little blurry, I need to get an eye exam. That's true, but when we do an eye exam for our patients, we're actually looking at overall what's the health of the eye and what is the eye telling us about the rest of this patient's body.
And what are the most common kind of, I guess, maladies or disorders that you're seeing and having to treat?
So it's very complicated. The eye, you think about how tiny of an organ it is, and can someone really spend years studying the eye and taking care of it? Yes. You really, want to see a general ophthalmologist to get a full eye exam, to really see those things that we're talking about: diabetes, high blood pressure, things like glaucoma and macular degeneration, or some of the more eye-related processes, not necessarily connected to the rest of the body, but of course important to your vision and your overall eye health. All of those things can get looked at, but we have 7 subspecialties within ophthalmology. So, for example, I got training after residency, special training, a fellowship we call it, in glaucoma. So I spent a whole year studying nothing but glaucoma and how to treat it. And I have colleagues who have done the same thing for the retina, which is another part of the eye that we see diseases like macular degeneration and high blood pressure and diabetes. So we all have our offshoots. So if I, as a general ophthalmologist, saw a patient and I was worried they might have macular degeneration, I'm probably going to send them to my retina colleague to do a more in-depth evaluation of that. So you, as a patient, when you think about why do I need to see an ophthalmologist, it's really because of that, because we have the expertise and the knowledge base and all these subspecialties to really hone down and say, is this process happening in your eye? The key is prevention. As with all of our healthcare, we all know the best way to stay healthy is to get the screening checks before something becomes a problem. And there's a lot we can pick up on an eye exam before the patient would ever be aware that it was an issue. Unfortunately, a lot of diseases like glaucoma and macular degeneration are kind of well on their way, and a patient will not have an idea of it. They may not have any vision symptoms. They may not have any, anything like eye pain, anything that would clue them in. So being in that process of getting a yearly eye check is extremely important.
Okay. Yeah, and like you said, I've been dealing with a friend who's got some eye issues, and fascinating some of the stuff he's got going on. But what are some of those preventative things that people can do, I guess, specifically for their eye health? You talked about diabetes. That's kind of a symptom, right? But what specifically for our eyes should we be doing?
Great question. Number one thing, as we get older, past the age of 40, just get your eyes checked. Even if you don't feel like anything's going on with them, you may not wear glasses or contacts, any of that stuff, get plugged into an eye care provider. Whether that's an ophthalmologist or an optometrist, it doesn't matter at that point. Just get your eyes checked. Optometrists are also trained to find those diseases we're talking about and refer to an ophthalmologist if needed. So just get that check after you hit the age of roughly 40 to 50. If you have a history of eye disease in your family, anything, glaucoma, macular degeneration, it probably needs to happen even earlier. So talk to your family members, make sure you know about any particular eye diseases that may or may not be in your family. Better to err on the side of caution and get checked soon. For things like, let's say, cataracts, everyone's heard of cataracts, and that's something that happens with age. So again, getting more regular screening as we get past our 4th decade is good for that. Wearing really good UV A and B, so full UV protection sunglasses, can keep cataracts from growing as fast. May not prevent them totally, but we live in the Sun Belt and we've got a ton of UV exposure, and if you're an outside person, those sunglasses should be worn all the time.
Okay.
Things like you were mentioning, other things to do. I'd say things like eating a really healthy diet in dark green leafy vegetables. We know that's great for all kinds of reasons, but because of the high antioxidant component of those types of foods, we've actually found that helps a lot with different eye diseases, particularly glaucoma and macular degeneration. So those are good things.
So you specialize in glaucoma.
Yep.
I don't know that much about it, so maybe that's a good thing. Hopefully that means there's no family history.
Right.
Tell us a little bit more about glaucoma, how it occurs, and what type of treatment you use.
Glaucoma is a really complex disease, and unfortunately, we also call it the silent thief of sight. The reason is it is one of those diseases that generally doesn't give you any symptoms. Even with a family history and all that, people have come to me sometimes probably 2 or 3 years after they should have, simply because they said, well, I knew that my mom or dad had it, but my eyes seemed fine, so I didn't get checked. So glaucoma really needs to be on your radar after 40 if you have a family history. Even if you don't know of a family history, just like I said, I'm going to sound like a broken record, but get those regular eye exams. But glaucoma essentially damages the optic nerve, which is the connection between our eye and our brain. And so the damage is usually very slow for the most common type of glaucoma, and it creeps up and it actually takes away our peripheral vision slowly. And eventually, when it's really advanced, can affect the central vision. Well, for better or for worse, our brain is really good at filling in gaps when our eye sees something. So people can lose a lot of their peripheral vision, but because most of the time we're using both eyes and looking, at things with kind of both eyes open, our brain often will fill in the gaps when we're still losing that peripheral vision. So that's not even noticeable.
So that's that new test. That's that test I do where the little
Yes.
squiggly pops up. And
I call it the worst video game you've ever done when I'm trying to explain it to patients. So it's not a whole lot of fun, but it's super important for finding those early visual field changes that you won't notice yourself.
and then how do you treat it if you catch it early enough?
Great question again. So treatments are always kind of developing for glaucoma. It used to be even 30, 40 years ago, we didn't have a lot we could do. People got diagnosed, we might have had a handful of medication and surgery that quite often would cause complications that might have patients lose their vision anyway. So we've come a long way. So that's a good news. We have a lot of medical therapy that we can start as usually what we do for first line patients when we diagnose them. So eye drops, and get used to putting drops in your eyes. That's harder for some patients than others, but that's generally what we start with. We have laser and operating room type therapy, the surgical therapies for people who maybe aren't well controlled enough on those medicines. So there's a gamut of that.
How prevalent is glaucoma?
Great question again. It depends on what population you're talking about. In the U.S., if you look across our whole population, it's not an extremely common disease. It's roughly about 2.5% of the population has it. Now, the key of that, though, is that about 50% of people in our population right now are walking around with glaucoma and don't know they have it.
Okay.
So within that small prevalence or number of people in the population, a lot of them don't know. So it goes back to getting that screening.
And those are the ones that without
treatment.
figuring it out,
Yep.
that you called it what, the
silent thief of sight. Yeah. So the people just go along their daily lives, and all the while, the optic nerve is slowly being damaged. And if you know about nerves in the body, we can't regenerate our nerves. That's where all that, all the work we've done on spinal cord injuries and things, once people get damage to nerves in their body, we generally can't regrow them. The same thing holds true for the optic nerve.
Mm-hmm.
And so, the key is treating in time. When it's caught early, it's a very manageable disease, and there's very little chance that you're going to lose appreciable vision throughout your lifetime. But the key is, catching it.
And I like the way you phrased it. If you're in your fourth decade,
Yep.
then that's
Time to
a
get
nice
an
way
eye
of saying if you're getting old, make sure you get that yearly test.
We can say seasoned, maybe.
Seasoned.
Yes.
Grizzled, in my case.
Yeah. Yep. Me too.
Anything else you'd like to share with the audience about their vision health?
I'd say it's kind of what you should kind of think about for your whole healthcare and your life and your health in general is be proactive. Make sure that you have an eye doctor, that you're seeing that person. And just thinking about how your life would be without your vision. It's a pretty scary thought for most of us. So that should be good motivation. I like to say that's a great thing about being an ophthalmologist is most people are really invested in, taking care of their eyes because, our sight is one of our most valuable senses. So it makes my job easy. I don't have to worry about getting patients on board. Pretty much everyone wants to do what they can.
Well, I actually feel like me having glasses takes care of that because I have to go every year because
it does help.
So it actually,
so there's a bonus to needing to wear glasses. Or contacts.
Finally, I found a benefit of wearing glasses.
Yep. And UTMB, our department is really well staffed to take care of glasses needs, contact needs, but also, like I mentioned earlier, that medical side of things, really finding out, do you have anything going on in the body that's manifesting in the eyes? Do you have any of these early signs of eye disease that we need to jump on and treat? So I think it really behooves you to go there, err on the side of caution.
Absolutely. Thank you so much.
Yeah, thank you.